Good afternoon. I am so thrilled to be here with you this afternoon, Dr. Eugenie Brown. And Dr. Brown, Associate Professor of Clinical Pharmacy at University of Technology, counseling psychologist, former acting Deputy President of the UTEC, University of Technology, Dean of College of Health Sciences for a number of years, where our focus was really on academic affairs. And so, Dr. Brown Mary, I just want to thank you for being here with me today. And in particular, for facilitating this conversation, and in particular, to highlight my book, yes. The Healer Needs a Healer. Because as an author yourself, you know that the message in a book is never meant to live silently between the pages.
That's so true. That is indeed the truth. And I am happy for the opportunity to be here with you. I'm actually very pleased and honored, Dr. Wilda Mills, to be sharing in this conversation with you today. You've been my friend for many years, friend and sister, in fact.
Thank you.
And I'm
glad you said sister. Thank you.
And I'm just so glad to know of all your accomplishments and just awesomely proud of this volume that you have produced. You, Dr. Dolores Mills, Doctor of Pharmacy, licensed clinical counselor, solutions-focused brief therapist, pastor, chaplain, so many things you have accomplished over the years. I'm just awesomely proud of you. But before we delve into the substance of the book that we're here to talk about today, I want you to tell me a little bit about this solution-focused brief therapist. What do they do?
Okay, so recently I have been privileged to sit under the tutelage of Elliot Connie, Dr. Adam Forer, Anna Francis, and Cecil Walker. And solution-focused brief therapy really carries a perspective that aligns with my book. And that is where we're saying that we focus on the best version of the individual. And so that is what I have learned. It really, really has resonated with me. And so in thinking of how my book fits into that kind of perspective, and borrowing from Elliot Connie's perspective, he was on a meeting recently, and he used an example which was really fascinating. He said, you know, if you had to choose between door A and door B, and one door was going to talk about how not to be, say for example, how not to be broke. Right. In my instance, I would say how not to be burned out. Or if you had the option of going through the other door which says how to be rich, in my instance, how to be brighter. And so I thought about my book, which really focuses on helping people to transition from burnout to bright. And I've coined for myself, you can say you heard it from Dr. Mills, 4 B's of burnout, and correspondingly the matching B's that will move us into becoming bright.
You know, actually, that was what I wanted to ask you about. Having, you know, had a brief look through the book, I noticed that it identifies the burnout syndrome as one of those key problems that healers themselves experience. And I wanted to know just how your book presents or serves as a bibliotherapy for health care providers.
2 words came from you there, Professor. You said burnout as a syndrome, and yes, we really want to recognize that it has gone to that stage. It's chronic. And then you talked about using the book as a kind of therapy. Right. So a quick story. In my family, my 3 children, they read. My daughter reads, my 2 sons, Michael and Melvin, and their auntie read, and Auntie Pam. And sometimes you would notice Auntie Pam, she has a book, a big volume, and she would be reading the book, and you see her even tears falling. She's crying and say, Pam, what happened to you? Really, she's identifying with the author of the book. So when you read my book, The Healer Needs a Healer, people who are experiencing burnout, like becoming blurry, where they are losing their perspective on their profession, it's not coming clear their goals, or they are burdened with the work so that they're not being able to manage appropriately, or they become even bitter. And when they become bitter, there's a level of cynicism that comes out. And broken. So when people read my book, they're able to say, oh, I am not the worst off. There's somebody in this book that has experienced it. So the bibliotherapy, they're able to see themselves in the book and to see that they're not worst off, and to find remedies in this book that would bring them from being blurry, burdened, bitter, and broken to balance, and to be able to set boundaries that fosters healing, and also to take a deep breath. And we all know, as a clinical psychologist, that people benefit from proper breathing. It's healthy, and it helps to ground people. And so also you will find in the book where it helps you to find your place as belonging again. So we move you from burnout to bright.
Excellent. I like the B's. I like the 4 B's of burnout and the 4 B's of brightness. I was looking through the book though, and on page 176, it made reference to the body-mind burnout cycle. I'd just like to share something that was very enlightening to me from that page. It says physical exhaustion in healthcare is not just a matter of tired feet or sore muscles. It directly weakens the emotional core needed to provide compassionate care. When a provider's body is consistently overworked and under-recovered, the mind loses its ability to stay grounded. Physical depletion drains energy, reserves that would otherwise support empathy, patience, and focus. As this pattern continues, what begins as manageable tiredness transforms into emotional dullness. This is a serious problem.
It is a serious problem, Professor. It is.
And it goes on to say this subtle shift is often overlooked, yet it marks the beginning of a deeper spiral into emotional burnout that affects both personal well-being and professional performance. So we can't sit idly, Dr. Mills, and allow burnout to happen in our healthcare professionals or caregivers. It's something that we really need to nip in the bud. And your 4 B's of brightness are very applicable in this situation.
I am so happy that you have really emphasized that portion of it, and bringing the interconnectedness, so to speak, between the physical burnout and the emotional. And on the subject of one of the B's, bitter, where it introduces sometimes a subtle bitterness which comes off as a caregiver being cynical. And I have a quick example of that, where somebody who is very notable in music and art and culture over the years, globally, he had a really bad experience, and it brought to light this drug propofol. And so people were very afraid of using propofol even when they're going through procedures. And so a question came to one of 2 anesthesiologists. And the patient, having heard about the propofol story, said, well, is this propofol going to kill me, when you put me under?
Yeah.
And one of the clinicians said, oh, yes, it can kill you. The other clinician said, that's why I am here to wake you up. Now, are we saying that we should give people falsified information? No. But in reference to what you said, right, we're not able to do that because we are becoming overburdened, and sometimes that level of cynicism seeps into our professional demeanor, would you say, or practice? Yes.
Both.
Yeah.
Yeah. Well, this book is really an eye-opener, and I believe that it is going to be very impactful in a number of practice settings, because as I have observed, the healers include a wide range of professionals. It talks about health professionals in the medical field, nursing profession, pharmacy profession, allied health professionals. It talks about caregivers in the mental health profession, caregivers in the homes. All of those individuals who have to provide care for someone else, they are individuals who may experience burnout.
That's correct.
And they need to know how they can access care for themselves so they can be well enough to perform their duties.
First of all, Doctor, I want to advise everybody to go and get this book.
Oh, yes, they need to go out and get the healer. Needs a healer.
And if I may, just from the preface in the book, it says, you can't really pour from an empty cup. So take care of yourself. And to expand on what you just said, bringing or categorizing different areas of caregivers, right?
Yeah.
Of course, we know of the professional ones, the ones who wear the title like yourself, Dean of, allied pharmacy practice and other health professions, pharmacists, clinical psychologists, pastors, and all of that.
Right,
so this, encompasses a wide range of people who really care. But what about those without the title? Like the mom, the dad, and the nanny at home.
Yes.
These people
different levels of caregivers.
Different levels of. So it's really expansive, and we're not leaving out. No child left out. No caregiver left out. We are all in it together. So really, yes, it's a book that really speaks to all caregivers, and fundamentally, we're saying that you cannot pour from an empty cup. And primarily, too, I want you to see the book as a permission. And that's why I think that the book has really taken on a kind of boldness to really say that no caregiver is invincible.
That's correct.
No caregiver is invincible. We are logical, and even talking about the highly skilled intellectual, not necessarily in here healthcare, but in government, in other
all
areas,
sectors.
all sectors, right? We are logical, but we are biological. And our body responds to stress.
Oh, yes.
Just as the patients that we
Indeed,
for,
it does. And that is why it is important that one can have their eyes opened through the information presented in this book, because it is pointing to all of the situations that can lead someone into this burnout, and also the signs, the recognition signs that will let an individual know that he or she is now experiencing burnout. And it is very important for us to know when we have a problem so that we can address it, in reasonable time before it gets to the extreme.
And I'm particularly glad that I'm speaking to you today, Professor, as someone who has had your hand in the curriculum of so many
I have spent
different, yeah.
so many years
Mm-hmm.
of my life in academia, and I have had the opportunity to work in administration. I've worked as a lecturer, professor, clinician. I've worked in so many different areas, and so I have a very good picture of what happens at the different levels.
Mm-hmm.
And in reviewing this book, I've come to recognize that addressing the problem of the burnout not only resides with the individual providing the care, but so many other persons
Mm-hmm.
are in the loop who need to help in that process of preventing the burnout or addressing it when it presents itself. And I, as someone from academia,
Mm-hmm.
I think that a lot of what our students or interns or whatever category they fall in, what they experience, especially when they're in the experiential learning environment,
Mm-hmm.
that it can lead to this kind of burnout.
Mm-hmm.
They are constantly on the go. The demands on them is so great. And I'm beginning to think, as I have been looking in the book, that there seem to be a place now.
Think on, Professor, think on.
That there
Think
is
on.
a place. Dr. Mills, as I was saying earlier, I've recognized through the reading of this book that the need for improvement in self-care to prevent burnout is not only the responsibility of the caregiver or the healthcare professional, but it is a responsibility of the systems or the environment or the leaders in these environments where our clinicians or healthcare providers or caregivers have to function. Being in academia for a number of years, I have been exposed to at different levels in administration, in teaching, as well as in clinical experiential learning. And I do recognize that we tend to push our students and our trainee clinicians. You know, we expect them to learn certain things. We expect them to gain skills and competencies in a number of areas. And in achieving that, we seem to consistently have them on the go. They're on the go because they must learn this and they must be able to do this. But since I'm recognizing here that all of this can lead to the burnout syndrome, I also see the place for other players in the institutions, in the clinical environments, to begin to understand the danger of this burnout syndrome and to address it in the most appropriate way. I was really impressed to see that a study has been written, a study has reported on some findings. A 2025 study found the urgent need for interventions, but not currently most burnout interventions are individual focused. It says there's a shortage of stakeholder-driven structural curricular interventions. There's a shortage of that. So it is pointing to us now, the educators and the administrators in these academic institutions, to address this deficiency. We need to address maybe the schedules, the workload, the types of orientation. All of these are areas where we can make modifications so as to prevent this burnout in our students and our trainee clinicians. And so this book is quite enlightening. It is sharing so much with us that can help us to make the necessary changes, adjustments in our programs, in the way we train our practitioners, so that they are better able to provide the best clinical services, but at the same time have the self-care or address the self-care that they need to enable them to remain competent as they serve.
Wow, that's really a moment for me, doctor, in a personal way, and
Yeah.
quite emotional too, because I have been through the rigors of this training, so I can speak from experience. And so this book is really written from three folds.
Okay.
And I want to call it, it's my PPI. So